For the next pregnancy complication we should be looking at, this is what is known as what abdominal pregnancy. Abdominal pregnancy. Okay, of course, if you say pregnancy, this is the normal one. We know that it's basically in the uterus. Okay, so anything you are saying different, this type of pregnancy, of course, the baby implanted in the wrong place. Now, for abdominal pregnancy, it's like the baby, instead of implanted in the uterus, the baby actually implanted in the abdomen. You understand? So, abdominal pregnancy. Okay, baby is supposed to actually implant in the endometrium. That's the lining of the uterus. Okay. Now, there are different places where the baby could implant. Now, we call that ectopic pregnancy. Once the baby is implanting outside the uterus. Now, this abdominal pregnancy is like a type of ectopic pregnancy, but this one, the baby is actually implanting in the abdomen. So it's a type of ectopic pregnancy, just like I was explaining. All right, so the fertilized egg, that's a sperm and egg coming together, but is growing outside the uterus, and for this one is actually what inside the abdomen. Now you could see different places, it could be in the fallopian tube, all down, it could be even in the ovaries. Okay, but this one was saying the baby is out in the abdomen. Okay, so it occurs when the embryo attaches to what abdominal organs or tissues. It could be the bowel, it could be the liver, it could be the spleen, it could be the peritoneum. Anything that is inside the abdomen, inside the person's stomach, is where the baby is implanted. All right, so unlike the tubal ectopic pregnancies, this one is what, when we say tubal, is a fallopian tube. It's tube that they call tubal. That one is much more common. All right, but abdominal pregnancy is not really common. All right, but it can occur. So risks and complication is life-threatening. Right, it makes the person bleed a lot. Okay, and it could cause complications to the abdominal organs. Right, so organ damage due to placenta inversion, fetal malformation of stillbirth, maternal mortality. The mother might end up dying from these complications. All right, mother might end up dying from these complications. So symptoms is what it might actually resemble a normal pregnancy, but with added warnings like missed periods, nausea, breast tenderness, abdominal pain. I think the vaginal bleeding should have come first. That's one of the warning signs, right? The bleeding is too much. Feeling of pressure or fullness in the abdomen. All right. Then abnormal fetal positioning. If the baby grows at all, or even when the baby was just growing, if you do some ultrasound, you see that the baby is not in the uterus, so it's in a different place. So diagnosis, that this baby is deep down there in the stomach, so you have to do all those images to capture it. Ultrasound, MRI, CT, laparoscopy. So treatment is what they have to just remove the baby. Okay. The placenta is deeply attached to vital organs. It may be left in place to avoid fatal bleeding. All right. The methotrexate may be used post-surgery to help absorb remaining placental tissues. All right. That's the wonderful, mechanism of the body. Some things the body can absorb it. Okay. That's why most of us we're conceived twins. Our twin died in the stomach, but the bodies were absorbed. That's it was early on in pregnancy. Okay, so that was what abdominal pregnancy simply means.